It is truly my pleasure to deliver some opening remarks at this important conference. After 4 years of research that has created an international network of collaboration and cooperation, this concluding meeting of the Birth Cost Action is truly a celebration of your sterling endeavors. Therefore, let me welcome the international scholars and researchers who are joining us from so many countries here in Malta. I must also take this opportunity to commend our very own Professor Rita Borchwirep and Professor Jean Kallea-Jus for their hard work over the past years to ensure that Malta makes a meaningful contribution to this important initiative. Improving and developing the equality of maternal health care for mothers and their babies is essential in all of our countries and societies. From the outset, I would like to state that I believe that the European Union must take more responsibility to harmonize equity in maternal health care across all of our European family of nations. In this way, we will be reducing avoidable deaths and limiting risks of ill health. Let me also state that this year marks the 70th anniversary of the United Nations Declaration of Human Rights, and our responsibility towards women and their children emanates from this supremely important instrument. This responsibility is also enshrined in the United Nations Convention on the Rights of the Child, which clearly commits us to provide effective prenatal and postnatal health care for all mothers and their children. Furthermore, our universal commitment is also reflected in the United Nations Agenda 2030 and its 17 Sustainable Development Goals, to which all of our nations are signatories. As all of us know, Agenda 2030 sets out the most effective roadmap for the sustainable future of our peoples and our planet. SDG number 3, Target 1, explicitly states that we have a global responsibility to reduce the world's maternal mortality ratio. I am confident that this conference will be an opportunity for us to build upon the valuable work we have already achieved as a community of nations to achieve this goal. Let me take this opportunity to draw your attention to the maternal health care in the EU Outcome Declaration developed in Malta last year. This document was developed on the margins of the meeting of the EU health ministers during Malta's presidency of the Council of the European Union, as well as incorporating subsequent sessions held in New York, Iceland, and Lithuania. In February 2017, my office, in collaboration with Women Political Leaders Global Forum and MSD for Mothers, held a roundtable conference entitled Equal Access to Maternal Health Care in the European Union. The outcome declaration from this roundtable conference highlights some worrying indicators from our union and emphasizes the need for our governments and healthcare services to take effective action. This declaration, a copy of this declaration is in this pen drive which I left with Professor Borchwirep. These indicators show us that 8 out of every 100,000 women in the European Union die annually while giving birth. According to data from the World Health Organization, every year there are about 1,800 maternal deaths in the entire European region. Furthermore, 54% of pregnant women who have been seen at Doctors of the World clinics in 9 European countries were reported to be living in precarity or poverty and lacked access to necessary maternal health care. An even more worrying indicator is the fact that 1 in 10 women in the European Union does not have adequate access to maternal health care. I am proud to say that my office, working closely with MSD for Mothers and women political leaders have responded to this worrying reality by carrying out an EU-wide study entitled Improving Maternal Healthcare for Vulnerable Women in the EU 28. And a copy of this report is also in the pen drive. The study, which was published this year, highlights the disparities between European Union countries when it comes to maternal health care and the lack of culturally sensitive maternal health care, both for vulnerable and non-vulnerable women. Furthermore, these indicators show that there are still gaps in the scientific research in this crucial area, and vulnerable groups are at particular risk of exclusion. A very important fact that needs to be highlighted is that women who are experiencing different forms of vulnerability and precarity are often less able to access essential maternal health care services. Research is also showing that such women include teen and young adult mothers, women of Roma heritage, women living in poverty, and other women who form part of precarious or minority groups. This situation is even more severe when we consider the challenges faced by refugee, asylum-seeking, and migrant women in our countries. Research indicates clearly that migrant and refugee women face elevated risks of marginalization and social exclusion when it comes to accessing even the most basic maternal health care. Furthermore, a document from the Race Equality Foundation entitled The Maternal Mental Health of Migrant Women states that, and I will quote, existing mental health services may not provide appropriate support to migrant women. Tools which help to diagnose maternal mental health illnesses are often tailored to meet the needs of Western populations and are dependent on women self-reporting their symptoms to practitioners, end quote. Taking one example from this report, postpartum depression manifests itself in a way that can vary from culture to culture and nation to nation. This is why I have continuously advocated for the visibility of maternal mental health care at a European and international level, which is, unfortunately, too often a neglected area. I believe that all mothers and their babies, no matter who they are or where they live, should have the same access to protection and support. I am convinced that you, as the experts in this sector, have the potential to be catalysts for a positive transformation in the areas of maternal, newborn, and child health care. This was also the focus of my contribution to the Humanity 2.0 Forum, facilitated by the Dicastery for the promotion of integral human development within the Holy See. As we know, 26% of global healthcare is, in one way or another, connected with the Roman Catholic Church, and therefore an emphasis on effective maternal healthcare within these services is essential. My patronage of Humanity 2.0 Foundation here in Malta is further supporting and giving visibility to these important issues. Maternal health cannot simply be considered as a women's issue. Dignified maternal health care is, at its core, an issue of fundamental human rights. This transformation will only be possible if all of our governments and authorities choose to invest effectively and efficiently in our women and girls at every step of their lives. It is my firm belief that birth cannot be taken out of the context of life itself. The journey of becoming a mother reflects the complex and intersectional realities that a woman faces throughout her life. It reflects her socio-economic background, her family history, her relationships, and her cultural context. We must ensure that a woman is seen in the light of her entire identity, holistically and with dignity. For this reason, I believe that we must invest in our education system to create a culture that is more capable of respecting the inherent dignity of women and their children. As academics and professionals who are working in this sector, you have an important role to play to promote new cultural norms which ensure safer and more dignified childbirth. We must focus on collaborative efforts on a regional and international level to raise awareness about the rights of vulnerable pregnant women, not just among the women and adolescent girls themselves, but also their families and communities. It is so essential for the policies of our countries to include relevant instruments which address high-quality maternal health care and are tailored to meet the specific needs of an expectant mother and her unborn child. Definitely, mental and emotional health must be part of this approach to holistically address the maternal health care of all women. On concluding, let me thank you for the work you have done over the past 4 years to generate essential and much-needed research. Let me encourage you to take this research and use it to raise the political profile around this issue. You are in a perfect position to provide the politicians and policymakers of our nations with the relevant resources to improve the well-being of expectant mothers. All of our countries have a clear responsibility to safeguard and to protect every mother. For this reason, let me recommend that this research be considered as a first step to create an EU-wide observatory on holistic and equitable maternal health care. I believe that mothers are the present holders of our future aspirations for the sustainable and peaceful development of our world. I look forward to exploring the final outcomes of this cost-action research study. I can assure you of my willingness to help with the dissemination of this important information at the highest levels of the European Union, with the hope that it will influence policy and create a much-needed positive transformation in our material healthcare systems. Thank you, and I augur you constructive deliberations.